everybody, Deirdre Verbo here on Let's Talk Seniors, Memory Care Issues, Alzheimer's, Dementia, and Parkinson's. Tonight we have a very special guest talking about Medicare. It could be super confusing, but she's going to simplify it for you. As a lot of you know, I opened up a home called Dogwood Home in Shelton. Very excited to say we have only 2 spots left. So if you are interested in a gorgeous home with loving care for your senior with any kind of memory care issue or assisted living need, give me a call. Also, I wrote a book, as many of you know, I might have the book. I also wrote a workbook called Home to Home, the Step-by-Step Senior Housing Guide. And it is a workbook that helps seniors, helps families guide what they should be doing with seniors. For instance, you know, your senior wishes. What do you wish to do? Do you wish to stay in your home and bring in help if something were to happen? Do you wish to sell your house? Do you want to move close to one of your kids? Which one? Or a family member, a friend? Where? Which friend? Where's the money? Is there long-term care insurance? Is there Social Security? Are you entitled to other benefits? Where is everything? What are your wishes for your funeral? What are your wishes for your life? And then thereafter. So it's a step-by-step guide that's great, because all too often, if you don't have everything set in place, it could take a few years to probate somebody if they pass away, or God forbid, even before that, something happens to you and now nobody knows your wishes. You break a hip, you have a stroke, and nobody knows really what you wanted to do. So they're now making decisions for you. So this will help your family decide with you beforehand what you want to do, where you want to go, everything they need to know about your circumstances so they can make the best decisions. I've had all too often so many of my friends. I had a girlfriend whose father had a stroke and he was running his own business. He was only 82, healthy as could be, and then totally couldn't handle anything. She had no idea where his money was, what his assets were, if he had insurance, anything. She didn't even live near him. And so it was a major to-do to figure everything out and to give him the best care. So it's good to have this plan ahead of time with your family. Well, I was doing seminars, teaching and giving people this workbook. You can buy it online on Amazon, or for free, you could just call me and I will be happy to send it to you. So tonight we have a special guest. Her name is Tracy O'Brien. And she's going to talk about Medicare and all the myths around it and everything you could do for the open enrollment period. And if you have questions, please write in and I can ask her. So Tracy, I'm going to read you a little bit about her bio. She's a Connecticut native and she's been working in the healthcare field for 15 years now. In 2010, she made the switch from individual health plans to Medicare plans with the rapid onset of the baby boomers turning 65. She's actually a senior insurance consultant. This is her specialty. In 2018, she started her own insurance agency with her husband, Chris, and they specialize in helping people transition into Medicare and helping people apply for the Medicare Savings Program. In 3 short years, they've grown to a team of about 25 agents. They are across Connecticut, Rhode Island, and Florida. That's amazing. And they're also licensed in about half the states. Tracy's also a volunteer with the New Haven Walk to End Alzheimer's, an ambassador for the South Central Area Agency on Aging, and a recipient of the 2012 Women of FIRE Award from the Commercial Record, and is 1 class away from her BS in Healthcare Administration. Tracy, I think you should take that class. She lives in Milford with her husband, their son who's 18, and their daughter who's 3. They also have 2 dogs, a tiny little dog and a great big Great Dane, 185 pounds. So welcome, without further ado, Miss Tracy O'Brien. Hi, Tracy. How are you?
Hi, I'm good. How are you? Thank you so much for having me.
Great. Thank you so much for joining us. This is something that can be quite confusing, learning all about Medicare and the difference between, I know Medicare, Medicaid, but just all the different plans and savings plans. But why don't you give us a little bit about your background more than I told people, because you've been doing this for quite a while.
Yeah, so I love to tell the story about how I actually came to work in deep into the health insurance field. It actually started with a wrong number. So I had gotten my insurance license in 2005 and I dabbled in it and I wasn't successful. And I was like, oh my gosh, I hate this. I'm never doing it again. And I went back into the restaurant industry, which is where I came up, and let my insurance license lapse. And then, of course, 2010, baby boomers, I made a call to one of the large insurance companies and got this guy on the phone, and I didn't know who it was. I hung up, called him back, thought I misdialed. He called back again. He called me back, and a couple hours later said, I missed 2 calls from you. How can I help? And sure enough, it was one of the big insurance companies. They were hiring for exactly the position that I needed to be in. And he's actually, my husband is my business partner here in Connecticut, but that wrong number guy is out in Vegas. And that is the reason why we launched Senior Insurance Consultants in 2018.
So that wrong number wasn't your husband.
It was not my husband, my work husband.
The right number guy.
Yeah, exactly. So
gosh, amazing. So this is 10, 11 years ago, and ever since you've been growing and growing and growing.
Yeah, so we did a lot in the under 65 realm, and then really 2014, even though baby boomers really started kicking off in 2010, but 2014 is really when things got crazy with the launch of the dual special needs plans here, all over the country, but here in Connecticut is one of the biggest things that happened. And that's when things got really confusing. That's when Medicare.
I'm sure you're going to tell us what that is.
Yeah, so that's when Medicare met Medicaid, essentially. Because it's like you said, it's confusing because they sound so similar. So, people transpose Medicare and Medicaid all day long. So, but Medicare is actually that federal program that typically you turn 65, you work 10 years, you worked 40 quarters, you become entitled to Part A, which covers your hospital, and then your Medicare Part B, which, you enroll in because there's a premium for it. And we can do a whole other show on Part A and Part B. But
Part A free. Is Part A free?
Part A is free.
What does that cover?
So Part A is your hospital. So if you're hospitalized, if you are in a skilled nursing facility, and then certainly, God forbid, hospice. So, and then
doctors' visits or
not Part A, no. So that's Part B. So Part B is your doctors, it's your outpatient hospital, diagnostic imaging, blood work, ambulance rides, things like that are covered under the Part B. God forbid, things like chemotherapy, radiation, end-stage renal disease, dialysis.
So does everybody have Part A and Part B?
Not everybody, no. So you have to qualify. So you have to either work 10 years or 40 quarters, or in the case that we see a lot now with the Medicare, Medicaid dual eligibles, many of them are under 65 and they qualify either through a parent, a lot of times with the really young beneficiaries, but a lot of them are under 65, they're disabled. They've been on disability for 24 months, and then on their 25th month, they become eligible for Medicare.
Okay, so not to muddy the waters, let's just keep with you're eligible, you're 65, Medicare Part A, it's free, or that's coming out of your Social Security check?
It's free.
Okay. Now Medicare
in theory, because you paid into it for your 10 years.
Now, so Medicare Part B is the doctors, chemo, and all that. Are there other parts?
So there is Medicare Part C, which is Medicare Advantage. So, they've really gained a lot of popularity. Those are the managed plans where people give the information, their Medicare A and B, to the individual insurance carrier for Medicare Advantage, Medicare Part C plan, and the private insurance manages their care. And then, of course, Part D, which is
Wait, so Part C is like private insurance?
Yeah. So Medicare Advantage plans are offered from the private insurance companies.
And do they range in price depending on your age?
No, not in Connecticut.
Okay.
So, most Medicare Advantage plans that we work with usually have zero premium. And I know people find that really confusing and hard to believe because they're like, how can the insurance company make money? I promise they are. But the part
I'm worried about them making money.
I promise they're finding a way.
That's not a big concern. It's like,
yeah, I think that's great that you're concerned with them. But so Part A you don't pay anything for, but Part B has a premium. So you actually choose whether or not you want to be enrolled in it. And for various reasons, if you're still working, have group insurance, you're on a spouse, you certainly wouldn't pay for Part B. But this year, the Part B premium for most people is $148.50 per month. So what happens is you're 65, you have your A, your B, you pay your Part B premium, you sign up for one of these zero premium Medicare Advantage plans, Part C, and then the Medicare gives some of that $148.50 to the private insurance to manage your care. So it's not free, it's just free to the consumer.
But it's only A, B, and C, Tracy?
So when somebody takes Part C, and then most Medicare Advantage plans include Part D, prescription drug coverage.
Okay, what if you didn't work 10 years and 40 quarters?
So it's expensive, but it is available. So you can actually purchase it.
So you can Medicare.
You can purchase Medicare. Part A, I can't remember the exact number off the top of my head, but somebody who couldn't get into Medicare from a spouse or something like that. Like if your spouse worked 10 years or 40 quarters, you can usually go under your spouse. But someone who maybe worked part-time or retired early, it can go up over $400 a month for Part A.
So if you're still working and you have your own insurance, you still get Part A when you're 65.
If you are, it's changed a lot over the past few years. Typically, yes. So the thing is that if you're not already enrolled in Social Security, they will not automatically enroll you in Medicare now. You have to flip a switch. Super duper easy. I say that because I've done it hundreds of times. But
it's not 65 anymore, is it?
It is 65. So if you're 65 and you're retiring, but you're not going to take Social Security because we know, I could say it's not ripe yet until you're a little bit older. So a lot of people are putting off taking Social Security. So you become eligible for the Medicare at 65, but you have to flip a switch. You actually have to apply. They don't automatically enroll you. If you had taken Social Security at 62, you would automatically be enrolled.
Got it. So, and if you take Social Security at do you have to take Medicare? Like if you get your Social Security at 70, are you automatically enrolled then, or did you have to enroll at 65?
You have to, so you would have had to enroll. There's certain enrollment periods where you can enroll. So let's say you worked past 65, you weren't taking Social Security, you just loved your job, and now you're 70, you want to retire, you're going to need Medicare. So you're going to need to apply for Medicare, apply for Social Security if you're going to start taking it. Definitely work with a Social Security specialist to see, what that perfect age is to start taking it. And then we get a permission slip from your employer to send with your Medicare application saying that you have a special enrollment period qualifying you to enroll so that you don't get any penalties assessed.
Interesting. So what is the savings plan, Tracy?
So the Medicare Savings Program, I refer to it as the best kept secret in town. It is actually a program for people who are on Medicare and depending on a person's income, gives them extra help with their Part B premium, their prescription drugs, and depending on, again, their income and the level of extra help that they qualify for, it may cover their copays on a Medicare Advantage managed care plan.
So the Medicare Savings Program might cover B and C.
Correct. And a lot of D.
Oh, and D. How do you have to qualify for that? How does one qualify?
So disclaimer, here in Connecticut, it's really a unique state. I know we have our challenges, but the Medicare Savings Program in Connecticut has some of the highest limits in the country. So a lot of people don't realize that they would qualify for extra help because the numbers are almost double of some of the other states. So, and it's income only at this time. So, if you own a home, you have a little bit of money in the bank, you have a car, as long as your income is under a certain amount, you may qualify. And
so it's not asset driven. You could have
not in Connecticut, not this year.
So how much is the income level?
So for the highest level income that a couple could make to qualify for some help would be $3,535.02, and as a maximum, and as an individual, $2,617.44.
And that's gross.
That is the gross. So that's before they take out taxes. That's before they take out your Part B premium. So it's the high number. And it's Social Security, it's pension if you're working, if you're taking monthly dividends from, an annuity or a 401k, it's all considered income.
What about like minimum distributions you might have to take, required minimum distributions from your?
So if it's coming out monthly or quarterly, it's typically considered income.
But if it's once a year, it's not?
It's a question mark. So there's nothing on paper that says it, but we find that sometimes it's a loophole that if people are taking it as an annual distribution, because it just goes from being this giant asset to now it's in your savings account. So as a one-time distribution, it doesn't really look like a monthly income stream. So I've seen situations where that's happened and, people have been able to qualify.
Interesting.
Mm-hmm.
Pretty cool.
Yeah, we don't encourage it just because we know that eventually the state will go to an asset test. They talked about it this past year, and I think because of COVID, it kind of got backburnered. But we'll see an asset test at some point.
So now, Tracy, what do you do? What does your company do for people?
So we really help people get into Medicare programs. But when I really got deep into the Medicare world, I was working for a large insurance carrier that launched what's called a dual special needs plan, a DSNP plan. And what these plans are designed to do is it works with people who have both Medicare and the highest level of Medicare savings program available, which is called QMB. And people get really confused. There's so many abbreviations. So QMB, what the heck is that? It's a qualified Medicare beneficiary. And what that means is that as an individual, their income is under $2,245.04 a month. So when someone qualifies for QMB, they qualify for these dual special needs plans. And what that is it's a Medicare Advantage plan, Medicare Part C, and it's offered by just about all the insurance companies now in Connecticut. There's maybe one or two that don't have it. But these plans are zero premium. As long as the QMB is active, they have no copays for any of their Part A or Part B services. It includes their prescription drug coverage. It gives them what's called LIS, or low income subsidy, which takes their copays down to $3.70 or $9.20. And it also covers the copay. So
let me understand this.
Mm-hmm.
Okay. So you don't have to you just have to make about $2,500. a month, but you could get the Medicare savings program if you make that. So what's the difference?
So the Medicare Savings Program has the 3 different levels. They have QMB, they have FLMB, and they have ALMB. So it's that QMB level extra help that is the high level.
This is a level to the Medicare savings program.
Correct.
So how much do you make it to go on to Medicaid? What is the
So Medicaid is an asset test. So the limits on the Medicare Savings Program are very high. So I've seen people where they have both QMB as well as Husky C or Medicaid. So the Medicaid, they get a spend down because their income's too high. But with the QMB, that covers their copays when they go to the doctor. So they're into plans, but the spend down just kind of hangs out there. They never meet the spend down because they're never spending any out of pocket.
So Tracy, that's amazing. Are you finding people that don't know about this and you're educating them?
Every day, every single day. Obviously pre-COVID, we spent a lot of time out in the field, low income housing. Like you said, I work with the Agency on Aging and I'm visiting nurses, and I've just been in the industry long enough that I've worked with a lot of people. But people, if you're not at a housing and going to an event where a representative is educating, maybe you're married for 60 years and your husband passed away and now your income together, you were fine, but you're not going anywhere where you'd ever get information about the Medicare Savings Program, and now you totally qualify.
So is this not something that Medicare mails to people?
Nope. So when somebody turns 65 or applies for Medicare, qualifies for it, they will send them some information about the federal LIS, low income subsidy, for help with prescriptions. But, I kind of get into the conversations with people just by accident, about their prescriptions and things like that. And it's my weird little gift that I identify people. And literally when, in the busy season, 5 to 7 people a week, I can find.
You know what, Tracy? It's amazing what you're doing, because this is just a little appalling to me, not anything you're doing, but this is a class of an age group that we're going to be in one day who need help because they are not online all day like, younger people. It's so confusing, like the elder care laws, the Medicaid laws, how to get like everything to protect them. Even a healthcare proxy used to be your spouse is automatic, and now it's not. Like, how do people know these things unless they're constantly going, like you say, classes or getting the information disseminated through, being at a senior center or something like that? It's crazy.
So that's why opportunities to speak with you are so valuable, because this will get out to possibly a population that I don't necessarily bump into. We do a lot of networking. We invest a lot of money in, Facebook ads, and we do, look for people. Our referral business is crazy because they know we help people. If you think it's confusing, try and apply for one of these programs. But you asked me before, what is it exactly that I do? I mean, we help people enroll in these plans, and then we help get them into a Medicare plan that gives them more benefits than they can get from just Medicare and Medicaid.
Are you finding if they enroll themselves, are often getting turned down because they don't know what they're doing?
They're just not doing it. If they're not applied for it, either they didn't know it existed, because in the 7 years I've been helping people apply for this, I've never seen someone get denied when they've truly been within these ranges. So something's wrong. I had a woman today. So we had applied back in, I want to say like September or October, and it's just been crazy with COVID and the holidays. And, they had the wrong information for her. So we finally got an appeal, got them the correct information. They put her plan in effect, and they retroactivated it back to September. So we see things, and, I have a mom can't get out of her own way. So most of the stuff I've learned the hard way through helping her. And I just feel like all these people are, could be my mom, could be my dad. So I support a lot of sandwich kids, help their parents. And then my agents are handpicked by me and my husband. They're amazing. And they extend my reach to help people because they're doing, their values are like mine. They're helping people, identifying opportunities to get extra help and get them more things that they deserve.
So Tracy, if somebody's on a regular Medicaid A and B, let's say, they might have C.
Mm-hmm.
If they find out about this dual special program fund, can they still apply? Like, is it too late if they're already on a program or?
So you can apply for the Medicare Savings Program anytime. One of the cool things about Medicare Savings Program is that when you qualify for extra help, and it doesn't matter what level, could be the high level, could be the lowest level that there is, but it gives you a special enrollment period. So it gives you an opportunity to change your plan at that time, either into a special needs plan or, this year, one of the carriers is offering the insulin savings model where they can really save money on insulin. So even without this Medicare savings program, but it gives people an opportunity to look differently at it when they have different levels of extra help. These managed plans, they're designed to give all the benefits of original Medicare and then some. So depending on if extra dental or glasses or medical transportation, over-the-counter benefits, hearing aids, things like that, that really helps a person or helps me help a person decide which plan might be the best.
Where does that fall under? Part D?
Those are under Medicare. So it's under Medicare Advantage. Okay. So it doesn't fall under A or B or D. It's depending on the private insurance company and what extra benefits they want to add into their plan. Yeah, there's so much. People are so hard on themselves. They're like, I can't figure this out. This is why I'm calling you. I'm like, we do this all day, every day.
Exactly.
And then it changes.
Oh, no. Exactly.
Yeah.
One of the things I do is I do short sale negotiating, and people, same thing. They're always like, I am so lost. And I said, I do 100 of these a year, and this will be the only time, once and done, you will ever have to go through a short sale. So you're not expected to know anything.
Yeah. Just know that, our goal, we don't work for the insurance carrier. We work for ourselves. So our goal is to get you in the best plan for you.
And are there different carriers that carry?
Oh, yeah. Every big name insurance carrier here in the state, for the most part, will have a Medicare Part C.
Ah, okay.
Yeah. If you go to Medicare.gov and you type in your zip code and you look for Medicare Advantage plans, there's, I don't know, maybe 30, I can't even remember, 30 of them in Connecticut for this year, more, 38, I can't remember.
So those are the ones that are really a choice. They're a choice.
Yep, they're a choice.
So if you didn't get any financial assistance and you took Medicaid A, B, C, D, how much are you paying?
There's still zero premium plans for people who do not qualify for any extra help from the state. Just most likely they would have co-pays every time they used a service. So, $5 at their primary care or $45 at the specialist, things like that.
So if seniors are paying $148.50 for Part A, like what could it add up to? What's like the max?
Well, they pay nothing for Part A. They pay the $148.50 for Part B.
Oh, Part B.
But remember, if somebody only has A and B, they're only covered 80%. So that's why people put these plans in place, because they give a stop loss. They have a maximum out-of-pocket risk. So even when somebody doesn't get the QMB or the extra help from the state to pay their co-pays, there is a place where if they they're not healthy and they do have a lot of medical challenges and they're using the insurance a lot, there is a place where the financial bleeding stops, essentially at usually anywhere from $5,000 all the way on up to about $10,000 annually.
Oh, so if you only could afford Part A,
Mm-hmm.
which is free. Now, let's say you do Part A and B, and that only pays up to 80%, and you get cancer. It's 80%, but then they put a ceiling on it, like the max amount of pocket might be 5,000 or 10,000.
Correct. So if you get cancer, you typically you pay 20% up to that maximum out of pocket risk.
Okay.
But and it'll be for another day. But there are other plans where Medicare remains the primary insurance, and they supplement with a Medigap plan where that covers the 20%. So another cool fact about Connecticut is we're what's called a guaranteed issue state. So if you're coming into Medicare and you do have some very expensive treatments, chemo, biologic infusions, things like that, Medicare supplement or Medigap is probably the way to go, but that's a whole other show.
Is that a Part D, or is that just a totally different thing?
That's just, yeah. So those that cancer stuff, the chemotherapy, radiation, infused biologics, those are all under Part B and just always very expensive. So imagine just having A and B and having no supplement or no Medicare Advantage. You just pay 20% until you can't anymore. So these are a way to protect people's assets as well.
So this is why people need you. So when they're 65, they should call you and sit down and figure out if they have any pre-existing conditions, what their family conditions may be in the future, heart issues or something, and what they think they might need.
Yep. We evaluate, we talk to them, we ask a lot of questions, we educate mostly, because at the end of the day, it's their decision. Some people, I refer to them, they're my young, healthy seniors, they're 70, they take one medication, they still go to the gym. Why not have a zero premium plan? You can go to the health club for no cost as long as, it's safe. And then every year, October 15th through December 7th, the annual election period, they can change.
What if you miss that period?
So if you miss that period, there's different enrollment periods throughout the year. So we just finished AEP, annual election period. Right now we're in what's called OEP, and you won't hear anybody talk about it because we're not allowed to. It's open enrollment from January 1st to March 31st. And essentially it's, I shouldn't say we're not allowed to talk about it. We're not allowed to market it. We're not allowed to, how everybody got crushed with mail during EDP.
Kind of like they wanted you to do everything a few months ago.
Right. So, but let's say you sign up for a plan in AEP and you go to your favorite doctor in January and they're not in the network anymore. You're stuck in this plan for a whole year. So now they've a couple years ago, they started OEP, where you could change Medicare Advantage plan to a different Medicare Advantage plan. One-time switch between January 1st and March 31st. So if you're in a Medicare Advantage plan, and you wanted to, if you missed opening the AEP, you could switch this first quarter. If you went into a Medicare supplement plan, you were like, oh shoot, I really wanted a Medicare Advantage plan. Can't do it. You have to wait till the election period.
So Tracy, what was the thinking behind making it such a short amount of time? I know you didn't do this, but making such a short amount of time to sign up. What are all your agents doing for the other 6 months and killing themselves for like 6 months? And what are they doing for the other 6 months?
So now
people up.
We are so busy all year round, especially because we are out identifying these people that qualify for this Medicare savings program, because during what we call lock-in in our industry, typically you can't change. But when you identify someone who qualifies for the extra help, it gives them that special enrollment period and opportunity to change their plan. So, and then the baby boomer situation, 10, 11,000 people are turning 65 every day. And
Oh, so they can enroll anytime they're 65.
correct.
Oh, so the other people, if you're in it already, you only can change it. I get it.
Yep. Yeah. The plot thickens. Yeah. So that's happening. And of course, we're working with employer groups and HR departments. This last year was exceptional because the furloughs and the job layoffs and the different companies that, people were furloughed and they kept paying their insurance. And then all of a sudden 2 weeks, oh, by the way, you're not going to have insurance at the end of the month. So, helping those people transition into either individual health plans or Medicare plans. We offer dental and vision and all kinds of life insurance, final expense. So we're busy all year round.
It's excellent. That's wonderful.
Yeah. And in July, we start getting ready for open enrollment again.
Nice. So in closing, what would you like to tell us about? What have you not told us? I'm sure there's a million.
Oh gosh, there's so much. So if you have questions, don't ever hesitate to ask them. There's so many questions. We learn something new every day, and we're in this every day. So reach out for help. One thing that people don't know is we don't charge anything for our services. So, when we help you apply for Medicare Savings Program or help you apply for Medicare, we just hope you'll let us help you apply for the plan with the carrier, because the carrier will pay us. And I always tell my clients, these managed plans are awesome. Some people are very anti them, but the insurance company is incentivized to make sure you have good outcomes. So they want you to be healthy, live nice, long, healthy lives. The insurance company pays us every year for as long as you're our client. So we also want people to live nice, long, healthy lives as well. Remember, I have a 3-year-old. I have one in college and one in daycare. So I need my clients for a long time.
Help you.
Exactly. Yeah, exactly. So yeah, and we just love what we do. So we're so fortunate to be able to, give such a great service to people and never have to ask them for a check at the end of our conversation.
That's great. That's fabulous. Well, thank you so much, Tracy, for explaining this. And as you can see, I took copious notes. I wrote everything you said down because I find it pretty confusing. I seriously scribbled everything.
If you have questions, call me, email me, text me. I'm super responsive. And if I get too many calls, then I have a whole bunch of just awesome agents that we can wrangle in and would be happy to chat.
I also think it's a kind of responsibility of the children of the elderly to know what's happening, to ask our parents, do you have everything you need for insurance? Because they might not be, investigating it as we would be.
Why would they know? It's not anything they have to deal with. And, I definitely help a lot of children of seniors. And, just to piggyback on what you said at the beginning, getting those important documents in place, they're hard conversations. I had to have the conversation with my in-laws. We just did a Zoom signing of the healthcare proxy and all that stuff with my mom. But it's so important because, if they can't make those decisions for themselves, or they're stubborn, like somebody's mom, with power of attorney, you can just go and apply for the Medicare savings program for them and be an authorized representative. Get them the help they don't even realize they need.
Yeah, and then the Generation Xers coming up, they research everything. Mm-hmm. So, they will know everything going on.
Yeah, none of this will be available by the time they're on Medicare.
But I don't have to worry. My kids will research everything to death by the time it's my turn to.
Yeah, have them call me.
Tracy, thank you so much for coming on. I know I'll be seeing you. And you're right out of Milford, but you do service the tri-state area and half of the U.S., right?
Yeah, so we're in Connecticut, Rhode Island, and Florida. I have agents in all these states. And then my partner's out in Vegas. So I have a lot of people on the West Coast. And I'm licensed personally in half the states, New York, New Jersey, Massachusetts, all up New England. And we're going to launch into Virginia this year.
Oh, one last question. How is it working with your husband?
Some days are better than others.
You do two different things? Are you like?
So we're very, very different. So, so he goes in the home office. I'm in the home office right now. Usually I work upstairs from the dining room table because he puts on his wireless headset and he doesn't realize how loud he is. So I go up, he comes down, and, I work more with the agents. He's a lot more systems and administration and stuff like that. So it's a good team. We bring balance to the universe.
Thank you, Tracy.
Thank you for having me.
It's so nice to meet you again and to hear all about what you do. And you're such a lively spirit, and I'm sure you love all your seniors and help them to the nth degree. I could tell. Well, if anybody wants to get in touch with Tracy, it's Tracy O'Brien, 860-659-7006, Senior Insurance Consultants, right out of Milford. Thank you so much, Tracy. We will see you again. Come on when it all changes again.
Absolutely.
Tell us all the new stuff.
New Year.
Okay. Thank you so much, Tracy.
Thanks.
Bye-bye for now. That was Tracy O'Brien. It's confusing. One of the things I find almost alarming is all that seniors have to know and learn about everything from taxes to finances, to healthcare, to where to live, to how to fund everything. It's really confusing at a time that you should be able to relax a little and not have to be figuring out your lives that you just did for the last 70 or 80 years. But so be it. That's what's going on. And hopefully children of seniors are helping their parents with all these major decisions. So thank you, everybody, for tuning in. And I hope you appreciated the Medicare show and learning all about the Advantage and savings plans as I did. And I thank Tracy again for coming, and we'll see you again tomorrow on Let's Talk Seniors.
Hi, Deirdre here again. Thank you for joining me on Let's Talk Seniors Memory Care Issues. Is this an issue hitting home? Do you have a parent or loved one with memory care? Hi, Deirdre here again. Thank you for joining me on Let's Talk Seniors Memory Care Issues. Is this an issue hitting home? Do you have a parent or loved one with memory care issues who feels not safe at home anymore? Are isolation, falls, and safety issues becoming a big concern? Welcome to Dogwood Senior Home, premier boutique residential senior living specializing in memory care. It's country living at its best in the Huntington section of Shelton, Connecticut. We're truly a home with only 6 senior residents living as one family unit. Senior residential homes are concepts sweeping the nation with 47,000 across the U.S. We're pleased to open Dogwood Senior Home as it will be only number 6 for Connecticut. Brand new, sparkling clean, opening mid-June. And safe. We are COVID-free. Residential care homes boast a very low COVID infection rate across the nation. This is due to the intimacy of size and speed in which the caretakers can shift to accommodate immediate needs. They are much safer than the large homes and facilities, as you can imagine. It has been documented that residents have less falls and a better quality of life in a residential home environment. Our home is more affordable than the big box facility. You pay one all-inclusive price, and that price is guaranteed for the life of the resident. With an incredible 1-to-3 caregiver ratio, which you won't find anywhere else. Our friendly, loving caregivers are dedicated and trained in Alzheimer's, dementia, and Parkinson's issues. We're only taking 6 residents, so the home will fill up fast. Call me at 203-689-7562 for a talk and tour. I would love to meet you and your loved ones.